Hello everyone, welcome to Aesthetic Skin and Hair Transplant Center. I am Dr. Faisal Hayat Khan and I am a dermatologist. Today, we will discuss about effects of sun exposure on our skin. Sun exposure can have both short-term and long-term effects on the skin, and it can lead to various forms of damage. Here are some of the key ways in which sun exposure can affect the skin. 1. Sunburn. Excessive exposure to ultraviolet UV radiation from the sun can cause sunburn. This is characterized by red, painful, and sometimes blistered skin. Sunburn is an acute reaction to UVB radiation. 2. Premature aging. Chronic sun exposure can lead to premature aging of the skin, known as photoaging. This includes wrinkles, fine lines, and a loss of skin elasticity. UV rays from the sun break down collagen and elastin fibers in the skin, which are responsible for maintaining its firmness and suppleness. 3. Hyperpigmentation. Sun exposure can lead to an increase in melanin production, causing dark spots, freckles, and other forms of hyperpigmentation. Prolonged sun exposure can exacerbate existing pigmentation irregularities. 4. Skin cancer. The most serious consequence of sun exposure is an increased risk of developing skin cancer. UV radiation can damage the DNA in skin cells, leading to mutations that can result in the development of skin cancers, including melanoma, basal cell carcinoma, and squamous cell carcinoma. 5. Weakened immune response. UV radiation can suppress the immune system in the skin, making it more difficult for the body to defend against certain infections and diseases. To protect the skin from sun damage, it's essential to 1. Use sunscreen. Apply a broad-spectrum sunscreen with a high SPF to exposed skin, and reapply it regularly, especially after swimming or sweating. 2. Seek shade. Limit direct sun exposure, especially during peak hours when the sun's rays are the strongest, usually between 10 o'clock a.m. to 5 o'clock p.m. 3. Wear protective clothing. Covering the skin with clothing, wide-brimmed hats, and sunglasses can provide additional protection. 4. Avoid tanning beds. Artificial tanning devices also emit UV radiation and can contribute to skin damage and an increased risk of skin cancer. Regular skin checks and consultations with the dermatologist are recommended to monitor and address any changes in the skin that may indicate sun damage or skin cancer.